There is something happening inside your body right now, tonight, that most people over 60 have absolutely no idea about. Your kidneys are two fist-sized organs sitting quietly at the back of your abdomen, and they are filtering every single drop of your blood around 24 times a day. That is roughly 150 liters of blood cleaned every single day. And the terrifying part is this. You can lose up to 90% of kidney function before you feel anything that you would actually call a symptom. 90% gone, before your body raises a flag. But here's what I want you to understand. The signs are there, they show up at night, and almost nobody is connecting the dots. Hi, I'm Dr. James Whitfield. I'm an emergency medicine physician, and just over a decade working in the ER, I've treated more than 40,000 patients. I've sat across from people in their 60s and 70s who came in convinced they just had a bad back, or that they were sleeping poorly because of stress, or that their legs were swollen because they'd been on their feet too long. And every single time, the blood work told a completely different story. Kidney disease. Silent, progressive, and already well advanced by the time I met them. This channel exists because of those conversations, because I kept seeing the same preventable crises over and over, diseases that had been quietly developing for years while people wrote off the warning signs as just getting older. My mission is simple. I want to stop you from ever ending up in the emergency room. And to do that, I need to give you the knowledge your doctor's 10-minute appointment probably never had time to. Today, we are going through 7 specific nighttime signs that your kidneys may be quietly failing after 60. I'm going to explain what each sign actually means, the mechanism behind it in plain English, the research that backs it up, and then at the end, I'll give you a practical framework for what to do next. This is not about scaring you. This is about giving you information that could genuinely change what happens in the next 10 years of your life. Before we get into it, I want to ask something. Only about a quarter of the people who watch these videos have actually subscribed to the channel. If you find this kind of content useful, please, please, please consider subscribing. It takes 2 seconds, it costs nothing, and it helps this channel reach more people who are trying to take their health seriously. I promise to keep making the most helpful videos I possibly can. And if you get to the end of this one and didn't learn something new, feel free to unsubscribe. No hard feelings at all. All right. 7 nighttime signs. Let's start with number 1. Sign number 1 is waking up to urinate multiple times through the night. The medical term for this is nocturia, and most people assume it is just a normal part of getting older, or a prostate issue for men, or a bladder issue for women. And sometimes it is. But here is what becomes really clear when you look at the research. Nocturia is one of the earliest warning signs of declining kidney function, and it is almost universally overlooked. Here is the mechanism. Healthy kidneys concentrate your urine efficiently at night. When you sleep, your body releases a hormone called antidiuretic hormone, which tells the kidneys to hold onto water and produce smaller volumes of more concentrated urine. But when the kidneys are damaged, their ability to concentrate urine properly gets disrupted. So instead of sleeping through the night on a small volume of concentrated urine, your body is producing larger, more dilute volumes throughout the night. Your bladder fills up, you wake up, you go. You come back, you wake up again, 2, 3, 4 times a night. There was a study published in the Journal of the American Society of Nephrology that looked at over 2,000 adults and found that frequent nocturia was significantly associated with reduced estimated glomerular filtration rate. That is the key measure of how well your kidneys are actually filtering your blood. The association held up even after adjusting for age, diabetes, and heart disease. What we know is that if you are over 60 and getting up more than twice a night to urinate, and this is a new pattern for you, your kidneys deserve attention. That is sign number 1. Sign number 2 is itchy skin that gets worse at night. Now this one surprises almost everyone. People assume itching is a skin problem. They try different moisturizers, they switch detergents, they see a dermatologist. And in many cases, it is a skin problem. But persistent itching that tends to be worse at night, particularly without any obvious rash, is a classic sign of what is called uremic pruritus. Let me translate that. Uremic means there are waste products in the blood that the kidneys should be clearing out, but are not. Pruritus just means itching. Here is what happens. When your kidneys start to fail, a whole range of compounds accumulate in the bloodstream: urea, phosphates, certain toxins. These compounds interact with nerve fibers in the skin and trigger an itch response. It is widespread, it tends to be dry, it worsens at night because the skin becomes more sensitive at lower body temperatures, and it does not respond well to antihistamines because it is not driven by histamine. It is driven by nerve activation from waste product buildup. Research published in the Clinical Journal of the American Society of Nephrology found that uremic pruritus affects somewhere between 40 and 50% of patients with chronic kidney disease and is severely underreported because patients assume it is unrelated to their kidneys. Let me be really honest here. If you have persistent itching that has no clear skin explanation and your kidneys have never been checked, that combination is worth taking seriously. Sign number 3 is restless legs at night. Restless legs syndrome, where you get this uncomfortable urge to move your legs, usually in the evenings or at night, is something a lot of people are told is stress or circulation. And again, sometimes it is. But the kidney connection here is significant and well established, and most people have never heard about it. The mechanism runs through 2 pathways. First, declining kidneys lose their ability to maintain proper iron metabolism and to produce a hormone called erythropoietin, which drives red blood cell production. Lower red blood cell counts mean less oxygen delivery, and the muscles and nerves of the legs become more irritable as a result. Second, waste products that accumulate with declining kidney function, particularly certain uremic toxins, directly affect the dopamine pathways in the nervous system that regulate leg movement during sleep. The research here is striking. A meta-analysis in the American Journal of Kidney Diseases found that restless leg syndrome affects between 15 and 20% of patients with chronic kidney disease, compared to roughly 5 to 10% of the general population. That is a 2 to 4 times higher rate. Now, here's where it gets really interesting. In many patients, treating the underlying kidney disease significantly improves or even resolves the restless legs. The legs were just telling you something the blood tests would later confirm. Sign number 4 is swollen ankles and feet that are worse by morning. Most people expect swelling to be worse at the end of the day after standing and walking. And that is true for simple fluid shifts related to gravity and circulation. But if you are waking up in the morning and your feet and ankles are already puffy before you have even gotten out of bed, that pattern is more concerning. That is kidney swelling. The technical term is edema, and the kidney mechanism works like this. Your kidneys regulate sodium balance. When they are not working properly, sodium starts to accumulate in the body, and where sodium goes, water follows. This water starts leaking out of the blood vessels and into the surrounding tissues. It pools in the lower legs and feet because of gravity, but crucially, unlike circulatory swelling, it does not fully resolve overnight because the underlying problem, the sodium and fluid retention, is continuous. So you wake up swollen. There is a second layer to this. Damaged kidneys also leak protein into the urine. Normally, protein in the blood acts like a sponge, pulling fluid back into the vessels. When that protein is lost, fluid leaks out into the tissues even more readily. A large study in the Kidney International Journal found that even mild edema was a significant predictor of progression to end-stage kidney disease over a 10-year follow-up period. Morning swelling is not something to write off as being on your feet too much. Sign number 5 is waking up with a metallic or ammonia-like taste in your mouth. This one is quietly one of the most specific signs on this list. People notice it and they blame it on their toothpaste, or their medication, or what they ate the night before. Occasionally that is right. But a persistent metallic or ammonia taste, particularly present in the morning, is a known symptom of what we call uremia, that buildup of waste products in the blood that the kidneys should be filtering out. Here is the mechanism. When kidney function falls significantly, urea, which is the main waste product of protein metabolism, accumulates in the blood. Bacteria in the mouth then break down urea into ammonia. That is what you are tasting. It is effectively your mouth detecting the waste products your kidneys are no longer clearing. Some people describe it as tasting like metal. Others describe it as a faint smell of ammonia in the back of the throat. It is a subtle thing, but it is your body communicating something important. The research on this is mostly from nephrology clinic studies rather than large randomized trials, but what we see in clinical practice consistently is that this symptom, when it presents in older adults without another clear cause, is associated with a glomerular filtration rate that has already dropped substantially. It is a late-stage sign, which is exactly why you need to catch the earlier ones on this list before you get here. Sign number 6 is difficulty sleeping and poor sleep quality despite being tired. This one is broader, but the kidney connection is real, and it runs through multiple pathways. People with declining kidney function consistently report poor sleep, frequent awakenings, and feeling unrefreshed in the morning, even when they feel exhausted going to bed. The mechanism here is layered. First, the accumulation of uremic toxins directly affects brain chemistry and disrupts normal sleep architecture, which is the natural cycling through different stages of sleep your brain needs to do overnight. Second, declining kidney function almost always creates some degree of anemia, a reduction in healthy red blood cells, and anemia itself causes fatigue and disrupts sleep quality. Third, many people with kidney problems also develop a condition called sleep apnea at higher rates, where breathing becomes interrupted overnight because kidney disease promotes fluid retention around the upper airway. A study in the Clinical Journal of the American Society of Nephrology followed over 5,000 patients and found that sleep disorders were nearly twice as common in people with chronic kidney disease compared to those with normal kidney function. And critically, poor sleep in this population was associated with faster progression of kidney disease itself. It becomes a cycle. The kidneys damage sleep. Poor sleep damages the kidneys further. Breaking that cycle starts with identifying it. Sign number 7, and this is the one I want you to pay closest attention to, is seeing changes in your urine overnight or first thing in the morning. Changes in how your urine looks when you first wake up are one of the most direct windows we have into what your kidneys are doing. And most people never look. Here is what matters. Foamy or frothy urine, the kind that bubbles persistently like you have shaken a bottle of soda, indicates protein in the urine. As I mentioned earlier, healthy kidneys keep protein in the blood where it belongs. When the filters start to break down, protein leaks through. That protein creates surface tension in the urine that produces foam. This is called proteinuria, and a study in the New England Journal of Medicine confirmed that even mild proteinuria is one of the strongest independent predictors of kidney disease progression and cardiovascular events in people over 60. Changes in color also matter. Very dark, concentrated urine first thing in the morning can indicate the kidneys are under stress. More concerning is persistently cloudy urine, which can suggest infection or protein, or urine that has a reddish or brown tinge, which can indicate blood. If you are seeing any of those changes consistently, that is not something to monitor and wait on. That is a conversation with your primary care doctor this week. So those are 7 nighttime signs: nocturia, itchy skin, restless legs, morning swelling, metallic taste, poor sleep, and changes in your urine. The thing is, most people with early to moderate kidney disease have several of these happening simultaneously and have connected none of them. They are treating each symptom in isolation while the underlying cause continues quietly. Now let me give you the practical framework I promised, because most videos stop at the list and leave you with nothing to actually do. Step 1. In the next 2 weeks, book an appointment with your primary care doctor and specifically ask for a kidney function panel. You want a basic metabolic panel that includes creatinine and your estimated glomerular filtration rate, And you want a urinalysis, which is a urine dipstick test that looks for protein, blood, and infection. These are standard, inexpensive tests. They are not exotic. But you have to ask for them. A lot of primary care visits do not automatically include these unless you are already a known diabetic or have high blood pressure. Step 2. In the meantime, start tracking the 7 signs I have described today. Write them down. When do they happen? How often? Have they changed over the past few months? When you go to your doctor, you are not going in and saying, "I think something's wrong." You are going in with a specific, organized history. That changes the quality of the conversation dramatically. Step 3. 3 lifestyle factors have the strongest evidence for either slowing kidney decline or reducing the risk of it starting. First, blood pressure control. High blood pressure is probably the single biggest driver of silent kidney damage after 60. Every single millimeter of mercury reduction matters. Second, hydration. Adequate water intake keeps the kidneys flushing properly. Most people over 60 are mildly dehydrated as a baseline because the thirst mechanism becomes less sensitive with age. Aim for pale yellow urine as your benchmark, not colorless, pale yellow. Third, protein intake. This is nuanced. Excessive protein puts strain on kidneys that are already struggling. If your tests come back showing reduced function, this is something to discuss with your doctor specifically. Step 4. If your tests come back and something is flagged, ask for a referral to a nephrologist. That is a kidney specialist. Early chronic kidney disease caught at stage 1 or 2 can often be managed and slowed significantly. By stage 4 or 5, the options narrow considerably. The difference between those outcomes is often whether someone paid attention to the early signs. Here is the bigger picture I want to leave you with. We have built an extraordinary medical system in this country. Dialysis machines, kidney transplants, critical care that can keep someone alive through organ failure that would have been fatal a generation ago. It is genuinely remarkable. But what we are terrible at as a system is catching the quiet, slow damage in the years before the crisis. That gap exists because the system is designed around treating disease, not preventing it. And filling that gap has to come from you. What becomes really clear after over a decade in emergency medicine is that the people who do best in their 70s, 80s, and beyond are almost never the ones who were just lucky with their genetics. They are the ones who paid attention, who did not write things off, who asked the questions their body was already raising. You watching this video right now, that is paying attention. That matters. If today's video was useful, please share it with someone over 60 you care about. Subscribe if you have not already, because there is a lot more of this kind of content coming. And leave me a comment below about which of these 7 signs you were most surprised by. I read them all. Take care of yourselves. Take care.